Hi guys, welcome to our YouTube channel Nursing Update. So today we'll see as a continuation of yesterday's video, Oncology Nursing. Okay, part 2 MCQs. Okay, if you are new to our channel, please subscribe and press the bell icon. Okay, daily we are uploading MCQs. Okay, this week we are seeing medical surgical nursing. Okay, let's move on to our today's video. The first MCQ is: a client with cancer is receiving chemotherapy and develops neutropenia. A nurse identifies which intervention has the highest priority in nursing care. Okay, option A, ambulate 3 times daily. Option B, monitoring for pathological fractures. Option C, monitoring platelet count. And option D, monitor temperature of the patient. Okay, the question is, the patient is on chemotherapy and he or she develops neutropenia. You should know what is neutropenia. Okay, neutropenia means decrease in neutrophil counts. Okay, how much if it is less than 1500? Okay, usually the normal neutrophil counts will be 2500, more than 2500 to 5000. Okay, so if it is less than 1.5 or 1500, that means the patient is in neutropenia. Okay, so there are many grades are there: grade 1, grade 2, grade 3. Okay, it will become 0 also. They will do a specific test called ANC count. Okay, in hemogram they do a specific test called ANC, absolute neutrophil count. Okay, that gives you the idea of whether the patient is neutropenic or not. Okay, so the patient is in neutropenia. As a nurse, what is the most important intervention you do? Okay, the answer is monitor temperature of the patient. Okay, so actually febrile neutropenia, the patient who is on chemotherapy, the most important side effect or the most life-threatening fatal side effect of chemotherapy is febrile neutropenia. Okay, so they develop fever and neutropenia, so they will chances of getting infection, fungal, bacterial, viral infection they get. Ultimately they go for sepsis, shock, and they may die also. So most important nursing intervention in the patient is in neutropenia is monitor temperature of the patient. Okay, clear with this? Okay, let's move on to the next MCQ. The primary reason for using prednisolone in the treatment of acute leukemia in children is that it is able to. Okay, so a patient is in acute leukemia and you are using prednisolone. What is prednisolone? Steroid. Okay, so why you are using steroid in that specific condition? Option A, decrease inflammation. Option B, reduce irradiation edema. Option C, suppress mitosis in lymphocytes. Option D, increase appetite and sense of well-being. The answer is decreases inflammation. Okay, so prednisolone, as I already told, is one of the corticosteroids used to decrease the inflammation. Okay, so in cancer, instead of having autoimmune response, they used to give prednisolone to decrease that. Okay, decreases inflammation. Okay, let's move on to the next MCQ. Mean of palliative care is. They are asking what is meant by palliative care. Option A, general care. Option B, ostomy care. Option C, pain and symptom relief. Option D, none of the above. Okay, the answer is one of the very easiest question: pain and symptom relief. Okay, what is meant palliative care? It is meant for relieving the pain and symptom. Okay, or else hospice care. Both are same. Palliative care, hospice care, end of life care, all are same meaning. Okay, it means how to relieve the pain and symptom to the patient. Okay, so one more point. So they have given one option as none of the above. So in most of the MCQs, if they given none of the above, it won't be the answer. Okay, don't choose none of the above as an answer, because the MCQs won't be that much simple. Okay, so most of the time none of the above will not be the option, so you have to choose other option only. Okay, so it's one of the hint point. Okay, coming to the next MCQ. What is the effect of cyclosporin in a patient undergone bone marrow transplantation? So option A anti-inflammatory, option B immunosuppressant, option C antibacterial, and option D diuretics. Okay, the patient is there. Patient is getting cyclosporine who are undergone bone marrow transplantation. Okay, in leukemia or in lymphoma and all, they undergo bone marrow transplantation. In that case, the patient is getting cyclosporine, a drug. What is the drug classification? The drug is classified under immunosuppressant. Okay, immunosuppressant. Cyclosporine comes under immunosuppressant. Cyclosporine, tarcolimis, these are under immunosuppressant group of drugs. Okay, so as I have discussed already in my previous video, these all MCQs have already came in some examination which occurred in 2019. Okay, I didn't take any MCQ from books or I didn't make any MCQs. These are repetitive MCQs from exams only. Okay, then coming to the last and final MCQs, a nurse assessment of a patient with lung cancer reveals the following: copious secretion, dyspnea and cough. Based on this finding, the most appropriate nursing diagnosis is, actually if you see nowadays paper, there is very less chances of getting nursing diagnosis as a MCQ. But there are chances, okay, once in a while, means if you take 10 exam in a year, at least in 2 or 3 exam, they are asking 1 or 2 questions based upon nursing diagnosis. If you take the scenario in 2014, 15, 16 or before that, okay, before 2010 or those scenarios, nursing diagnosis based means NCLEX based MCQs are most frequently asked, but nowadays it is very less, but still it's not fully vanished. Okay, still there are probabilities are there, we are getting MCQs on nursing diagnosis. Okay, so they have given the scenario, the patient is having dyspnea and cough and copious secretion is there. What is the nursing diagnosis? Option A impaired gas exchange, option B ineffective airway clearance, option C pain, and option D altered tissue perfusion. The answer is ineffective airway clearance. Okay, so that's all about today's video. So if you are new to our nursing update channel, please subscribe our channel and press the bell icon. Okay, so your like meant to us a lot. Okay, the more we get the like, the more motivate me to do more videos. Okay, and share with your friends also who are in preparation for competitive exams and your batchmates or your friends, whoever it may be. Okay, thank you so much guys.